Looks like we're starting to have a good crowd come in. Welcome, everyone. We'll get started. We'll just wait a couple of minutes. I know that there was a webinar right before this, so people maybe needed a very quick break in between. So I want to give everybody time to join. Okay, I think I want to welcome everybody. I think we're going to go ahead and get started. I know people will be joining us as we go along with this, and sometimes that's what also happened with the others. People would come in maybe on a certain webinar that they really wanted to participate with or listen to. So we'll get started just due to time. I want to welcome everybody and thank everybody. And for those who are returning for this third series of this webinar for our IEE Work for Voices for Healthy Kids. It's been a great team to work with, a lot of great leads and organizations that have participated in this work. So let me go ahead and introduce Susan Morin, our facilitator, for today's call. Some of you may have already heard this and already know her and her beautiful face, but we want to just go ahead and I want to share with those who may not know who she is. Susan is the Director of Operations for the consulting firm My Power People, founded in 2018, and it helps clients advance their mission through policy advocacy and community engagement. Before joining My Power People, Susan was an associate with the New England division of M&R Strategic Services. That's how I first got to know her, when she worked with Lori. She has extensive operations and business management experience and has dedicated much of her career working in the nonprofit arena, collaborating on strategic action planning, research, community organizing and engagement, and grassroots mobilization and training. Susan lives in Lexington, Massachusetts with her family and is an active member in her community, volunteering for Meals on Wheels and Cradles to Crayons. Susan also founded the Build Our Kids Success box exercise program at the local elementary school. Susan holds a Bachelor's of Art degree in psychology from Loyola University in Maryland. Welcome, Susan, and thank you, everybody.
Thanks, Nada. I'm thrilled to be back again for the third out of 4 series that we have for you guys. And for those of you that have joined us before, welcome. Welcome back. So before we hear from our speakers, I just wanted to give a quick overview. Please keep your line muted and use the chat box function to submit any questions. We'll monitor the chat box throughout each presentation, and we will also have an opportunity at the end for question and answers. The webinar is being recorded, as you heard, and we can share the link and the speakers' presentations with you. So it's my pleasure to introduce our first presenter today, Amanda Merck with Salute America. Amanda?
Hi, everyone. I'm going to go ahead and share my screen, which we should all be professionals at by now. Okay. So thank y'all. Yeah, so much for joining this webinar. Oh, did that just take me out?
Yep.
Okay.
We see you.
There you go.
Okay. Oh, well now, yeah, now that hid my notes. Okay. You know, you practice these things. Okay, so I'm gonna, oh boy, we're gonna do this. No, we're not. Oh no.
Amanda,
Yes.
if you would like Yui to advance your slides, she can take over the screen control, and then you can have your notes in front of you if that would be helpful.
Okay, I think, I'm gonna just share my other screen because I've got the duplicates. I think that's what's, so I'm just gonna use the tiny screen. So sorry, y'all. Okay. here we go. Okay, sorry about that. Okay, so now we're good. You'll see. No, now it went back to present. Yeah, but that still leaves me without, no. Okay, how's this? Full screen?
Yeah.
Okay. Thank you all so much. My name is Amanda Merck. I'm with Salute America at UT Health in San Antonio. We are funded by the Robert Wood Johnson Foundation and led by our director, Dr. Amalie G. Ramirez. I'm going to just tell a teeny bit, or here's kind of the agenda we'll go through. I'm going to just touch on who we are real quick, and then I'll go into sort of the catalyst for us applying for this IEE project, and then work group members, some of the questions we wanted to address, our findings, and then how we are presenting them into two reports, one brief, one kind of more in depth. And then just to go over kind of our action plan, our call to action. So we're a Latino focused health communications project. We aim to share research, resources, and stories to inspire people to get involved in the policy, systems, environmental changes needed to bring about healthy communities to improve Latino health equity. So we curate content daily. We share through our national networks through various social platforms. And with that content curation, we've done our own research reviews. We create culturally relevant multimedia like animated videos and infographics. And then through our various social platforms, Twitter and Facebook, we share a lot of content. This is an image from our research review that we had released about 1.5 years ago, which was, as kind of Salute America, we'd been focusing on Latino childhood obesity for a long time, the school environment, kind of parks and stuff. And we hadn't really gotten into transportation very deep until this. And so this is sort of what led to us thinking about that connection between transportation and health a little bit more. And so looking at the Voices for Healthy Kids policy priority areas, they had their bike and pedestrian appropriations and complete streets. And we kind of know, I'm sure everyone on this call knows, when it comes to health, physical activity is critical, right? So to be healthy, we just need more people to be more physically active, to walk and bike more. But we all know it's not that easy. There's so many social, environmental barriers. So then to get people to walk and bike more, we just need more sidewalks and bike lanes, right? But we know that it's just so much more complex than that as well. And so when thinking about sidewalks and bike lanes, it's a lot more than just building the infrastructure, because there's a legacy of discriminatory land use and transportation practices and policies that created opportunity in some neighborhoods and disadvantage in other. So going and investing in certain infrastructure now leads to a huge problem, displacement. And then another problem is the disconnect between physical activity for health from a recreation point of view, from walking, biking in your leisure time, versus walking, biking as a form of transportation, as a necessity for some people to get where they need to go.
Amanda,
So I'm kind of,
I'm
yes.
so sorry to interrupt you. I just wanted to let you know that your slides are not advancing.
Oh, that's,
we're still seeing the very first slide.
oh boy, I do not know what to do about that. Okay, let me just maybe X out and go back in.
Again, if it's helpful, Yui can definitely put the slides up on her computer, and you just tell her when you want to advance them. And that
More than happy to.
Yeah,
oh, I see the comments now too. Okay. Oh man, I legit practice this. Okay,
No
Let's
worries.
stop share and try again. Okay, last attempt. Okay, so y'all see that?
Yes, we see the transit slide now.
Okay. So yeah, these are the two Voices for Healthy Kids policy priority areas. So yeah, everything I was saying, just that connection between health, but then investment can lead to displacement. Also, just how to reconcile recreation for like leisure for privilege versus transportation as a necessity. So that's where we kind of begin questioning. So what about the connection to transit? If we're thinking about transportation holistically, not just from the health, from the physical activity point of view, but from the connection as a lifeline in their community point of view. And so that was kind of where Salute America was coming from with wanting to pursue this IEE opportunity. So we did the slide advance.
Yes, we're on the
Okay,
board. Yep.
Here we go. We're cooking now. So these are the 4 questions that we wanted to explore. And we already had quite a few national transportation leaders in mind for this work group. And then as we were coming up with some of our questions, it helped us identify some other individuals that we would want to participate. So these are the 4, just what are the implications of not connecting Latinos in transit, of particularly investing in active transportation that's not connecting Latinos to transit. And then is there adequate information out there to support the need to do that? And then what sort of trainings and tools and resources are out there to possibly elevate this need to integrate transit and active transportation? And then what role do transportation professionals, public health professionals, what role do they in calling attention to the true costs of driving? Those external costs are not really brought to the public's eye. And so there's a lot of misinformation or misconception about what's subsidized when it comes to transportation. That can lead to solutions moving forward when there's a lack of understanding about how it's even financed to begin with. So these are the questions that we wanted to explore. And these are the work group members that we sought out. I mean, and it's just such an amazing group of people. We, like I said, already had quite a few in mind. Some of just finding those people that were kind of already at the intersection that already kind of get it. We wanted not just transportation planners, but we wanted the urban planners also. We wanted that land use point of view, the housing point of view. And then we wanted scholars, planning scholars. And we also wanted people in public practice, working for governments, but also in private practice. And then what? And then we wanted ones that also were working at other intersections, maybe not health specifically, but with like food access. Maybe, they're not completely focused on the health benefits, but they recognize the social benefits of transportation and food. So we just wanted some people who are kind of at the intersection of these various places. So this is our work group. Those were the questions. And then I do want to acknowledge that this is even possible for Salute America to pursue this because funding in part through the Voices for Healthy Kids, an initiative of the American Heart Association with support from the Robert Wood Johnson Foundation. So thanks to them, we were able to ponder these questions and bring an incredible group of people together to help us with that. So these are findings. So through our year of work group meetings, we met 8 times as a group. We had 2 online learning modules, and we also had 4 guest presenters, 4 nationally recognized guest presenters. And then I had a lot of one-on-one calls with work group members as well. So here's some of the findings. Just ultimately in the work group, everything went back to it. It's so difficult to try to address just the integration of transit and active transportation right now, when as a whole, we have not gone back and like fixed these discriminatory policies and practices that still plague communities today, that still segregate communities today, still disinvest in communities today. So that was huge. That came up a lot, is we can't just fix this one small piece right now when like the whole bigger machine is so broken. Another reason that, you know, the whole machine is broken is lack of diversity, racial, ethnic diversity, as well as gender. And this is in transportation, land use. This is also in decision-making, in elected and appointed officials. And then another issue is just a general lack of understanding and consideration for unique Latino needs and experiences. Data collection, travel data collections, bleak. And that's just usually from kind of the behavior infrastructure point of view, and not really from like the social cultural needs point of view. And then another is silos. And I mean, I know that is not news to y'all. This is something I know health advocates everywhere face, silos, but just even in planning, urban planning is very siloed from transportation planning, which are very siloed from transit planning. So just needing to address that. So all these problems, this like broken machine, has contributed to these entire cities and states that are auto-centric, auto-dependent. You have to have a car just to get around. They're racially, economically segregated. And then further leading to displacement concerns, poor air quality, inequities in health, chronic disease, numerous chronic diseases, disparities in injury and premature death from crashes, and then inequities in socioeconomic outcomes, because if people don't have transportation options, dependence on a vehicle is costly. I mean, it's anywhere from $5,000 to $8,000 a year. That's $25,000 to $40,000 in 5 years. I mean, imagine what families could be doing with that. So not just from the physical activity point of view, but from the transportation as a necessity to get to opportunity point of view. So kind of among those, the four key problems, like I kind of mentioned, lack of diversity, concerns about displacement, this auto-centric status quo that I'm going to go into a little bit more, and then these agency silos. Okay, so back to the work group research questions. So the first one was, what are the implications of complete street and walking and biking projects that don't connect Latinos and low-income populations to frequent transit service? So from the like recreation versus transportation point of view, what we found is communities they're not happy. They're standing up and speaking out against some of these beneficial active transportation projects because of concerns about displacement. They've seen it in communities across the country. And so there's times where many planners, you know, they think that we're bringing in the sidewalks and the bike lanes so people can be active. Like, what's the problem? So it's a big problem. And then the other issue with not considering that connection to transit is it perpetuates this idea that walking and biking are this leisure activity for the privileged. Whereas these families living in wherever these areas are that is about to be investing in these projects, they don't think of it that way. They don't think they need it that way. It is a lifeline for them. It is transportation options to get where they need to go. So having to like reconcile those and address displacement concerns. I mean, these are huge problems. This is what planners are facing across the country. So question number 2, a recommendation to modify complete streets and walking bicycling advocacy to include improvement of and access to frequent and equitable transit. There's so much out there. Like, this isn't new. And that's kind of what was really eye-opening about this group too, is this isn't new. so many of these mid-level planners want this. They understand the importance of talking with the community, ensuring that whatever projects they're doing gets them where they need to go. It's not just recreation, it is transportation. They understand like the bigger picture of what needs to go on around the sidewalks and bike lanes related to like design and density. And so the evidence is out there. It's a lot. This isn't new by any means. The problem is, because of that auto-centric status quo of this like legacy of discriminatory planning, is developers are designing to existing ordinances which prevent and contradicts the density needed, the better design practices to actually support these changes. And then similarly, engineers are designing to the standards. Also, I mean, these are from the 40s and the 50s for highways, applying them to urban roads. And they contradict the active transportation benefits intended. So they're designing to these ordinances and these standards have been set in place for decades, rooted in a history of discriminatory planning. And so when it comes to planners on the ground trying to work on like one project here, they're up against these entrenched ordinances and these entrenched standards that are just happening across the rest of the city. So even if they're fighting for this one project, doing everything they can with the community for the community, it doesn't matter because it's baked into this system. It's just happening everywhere else. And then because of this shift that planners have had, they know what needs to be done to build better cities, to build healthier cities. The ordinances and the standards have not kept up. They have not made that shift. And public and political will hasn't totally made that shift either. So political will is bending to homeowners' complaints about, you know, low-income apartments in their neighborhood, which is great for density, which could help support additional active transportation investment, public transit investment. And all of those complaints are, you know, kind of, okay, I'm not gonna say that. So political will, public will have not made the shift yet. And then the other issue is there's not good data out there on Latino travel behavior. The little travel data we have is rarely disaggregated by race, ethnicity, income, age, gender. And so much travel data is just focused on the commute trip alone and not the various other trips families are making every single day. And so we have these ordinances and these standards built on travel behavior from the 40s and the 50s of a white working man. And so they haven't addressed Latino needs. And then also social and cultural needs of what Latinos want, what they want their community to feel like, having safe places to walk and bike, of course, but other factors that go into that. Okay, I'm taking way longer on this slide. Okay, so what resources are out there? What trainings, tools, communication materials, and other resources were produced to integrate frequent and equitable transit service with complete streets and walking bicycling projects to enhance and support work in this area? So there are definitely some resources. I'm not going to go through them here. They're in all of the reports. We link to many of them with the various recommendations. But among that, we recognize where there's not many resources. There's a gap in community engagement best practices specific to Latinos, getting them engaged in not only at the project level, but at the policy level. Gaps in resources on Latino design standards. So, you know, not standards from the 1950s suburban sprawl neighborhood, but what about more mixed use, a little bit higher density design standards? And then the fourth question was awareness. So what role do transportation professionals play in raising awareness about the true costs of driving and the need for frequent and equitable transit? And this one was tough. This one, like, we got nothing. Like, there needs to be something to push for that kind of responsibility and like accountability in sharing accurate information instead of perpetuating that congestion is like the worst problem a city can possibly face. And we have to solve congestion. And the way to do that is to build more and wider roads. So we wanted to explore, like, cities have far other bigger problems than congestion alone. Many health, social, economic issues they're trying to work on simultaneously, and we need transportation to be a part of those. So needing trainings and workshops for these. And then the other, so those were our 4 questions. Then our 5th question was other observations that came up in the group that the questions didn't address and that we thought were important enough to include in and continue pursuing. One is the issue of total emissions. So much transportation data or reporting on greenhouse gas emissions is tailpipe emissions only, and it doesn't account for non-tailpipe emissions like brake wear, tire wear, road wear, auto manufacturing, the emissions just from that industry, and then also construction of roadways and the emissions that goes into building the roadways and the parking lots. So the need to address total emissions, this idea, tailpipe emissions is just like, it's important to set goals, but in the big picture, it's like a minuscule, it's like small potatoes. The other issue that came up is over policing. And everyone I'm sure is aware of drawing a lot of attention to this. I don't even want to say right now, this isn't new either. But drawing attention to this when talking about safety specifically, in that some Black and brown communities have these other barriers that maybe white transportation planners aren't thinking about. So addressing these other silent barriers. And then COVID happened. And so this changed transportation behavior. All of a sudden we have a huge portion of the population not commuting to work anymore. They're staying home. We have a huge portion of the population not going anywhere. They're staying home. They're, condensing their shopping trips to like once a week instead of multiple trips throughout the day. So all of a sudden we have far fewer cars on the roads. We have health concerns about transit, and we have far more people walking and biking. And so this changed everything. I'm sure a lot of y'all have experienced the transportation impacts of COVID. Okay. So those are kind of the findings that we came up with within the structure of our 4 key questions. The main considerations that we came out of this with is that any efforts moving forward from the health point of view, from the equity point of view, from transportation, land use, is that it needs to be inclusive of Latino needs. That's going to require a level of, qualitative, quantitative data collection. It's going to require better community engagement, getting on the ground, finding out what these needs are, not just from an infrastructure point of view, but from social, cultural needs as well. The second key consideration is it has to be representative of existing inequities. So many plans and projects are presented and they completely neglect the historic segregation that community is facing. And they leave out entirely that certain neighborhoods were provided opportunities and other neighborhoods were disadvantaged by barriers. And by neglecting those existing inequities that are happening in that community, in that city, residents feel it. They see that y'all planned what we have right now and it's not working for us. So like, you got to give us something better. You can't ignore the failures of the past and expect us to like jump on board and support everything you're saying now, even if you are the technocrat, you have the like technical expertise, but you're missing the like humanitarian side of this. And then the third key consideration is responsibly evaluated and measured. So much so, like the city ordinances and standards I mentioned before from the 40s and the 50s, they established performance measures and metrics, and they are just out of line, and they focus, they measure the wrong thing, they state the wrong goal, they state the wrong problem, and they state the wrong goal. So we need to go back to these existing manual standards, plans, how agencies prioritize projects, how they measure success, and update and revise those metrics to reflect more health, equity, social outcomes, rather than most are just targeted on congestion. So I don't think I explained that one very well, but I'll get into that a little bit more too. So these are the key considerations moving forward. All right, so we put all this into 2 big reports that we just released today. The link is at the bottom of the slide. We have the one report with, for Voices for Healthy Kids with kind of, the grant requirements in mind, their policy priorities in mind, their audience in mind. And then we have another larger, kind of more in-depth report that we wanted for our national audience and for the work group members as well, something they can, a tool they can take with them. So if you want to screenshot this or just like write down that link. So in the brief report, the 3 key recommendations that came out is fill in data and resource gaps to prioritize Latino experiences and needs through the planning process. The second one is dismantle racism, promote racially, economically mixed communities through land use, transportation policies, regulations, and laws, and prioritize equity, safety, and health in metrics used to determine impacts, the metrics used to establish targets, the metrics used to measure performance, and the metrics used to score and prioritize projects. So I'm going to speed up. These are 3 recommendations, or not 3 kind of actions within that first recommendation to fill data and resource gaps. And in, best practice to engage Latinos, workshops and resources to inform planners and engineers. These are 3 recommendations, or 2, there's more, under dismantling racism and promoting a racially and economically mixed neighborhoods. So tracking these success measures publicly, economic neighborhood diversity, spatial mismatch, the transportation and housing cost burden. So much focuses on transportation costs or on housing cost burden without consideration for what these households are spending on transportation. Revising land use zoning codes, this is huge. And then here's 3 specific actions under the recommendation to revise the metrics. So I flew through those pretty quick. And then this is the second report. So the first kind of brief report, I mentioned we had the 3 recommendations. This report, we categorized everything into 6 topic areas. So community engagement, planning, design, land use, policies, regulations, metrics, and then investments. And then within each of these are multiple goals and then very specific actions, policy, advocacy, research recommendations within those goals. So I'm going to flip through those pretty quickly. I'm just gonna go right to this one. Okay, so yeah, well, I'll just do the get closer to our screen. This is a screenshot straight from the report, and I wanted this to illustrate not just the recommendation itself, which of course I want everyone to like be familiar with all the recommendations, but in how we wanted to display or how we wanted to package these recommendations. So we've got the main goal, we have the big action, and then within that action, sometimes like this one, there's a lot of sub actions that need to be considered to accomplish that. This is often in areas where there's just a huge gap. There's just not enough information as it is. So this is an example of that. Lots needs to be done to develop community engagement best practices, inclusive of Latino needs. On the right side of the screen, you'll see there's governance and parties. So within all of these goals and the key actions, we broke down who the key players are, who the decision makers are, who the advocates and the stakeholders are. We also broke down what type of action this is. And I'll show a couple more screenshots of that. And then going back to those 3 key considerations, inclusive of Latino needs, representative of existing inequities, and responsibly evaluated, we tie those in so people know kind of who's making these decisions or who has an effect on these decisions, at what level is that action, and then ensuring these key considerations. And then the existing resources. So I mentioned before, there's some resources out there, so we wanted to link to them. There's a lot of overlap. You know, we didn't like recreate the wheel here. A lot of these recommendations have been out there. Like I said, this isn't anything new. So linking to those resources as well. So I'm going to skip this slide. Here is another example of a goal and action. And then this one again, this one has quite a few sub actions. Not all of them do. Some of the goals, like another land use goal or another land use action, is simply end exclusionary zoning. That's it. Bunch of white space on the page. It's pretty simple, pretty basic. Still having a hard time with that one though. So again, there's the governance, parties involved, what type of action it is, and then existing resources. And this, I mean, so many of these, especially now with COVID too, with it's changing not only transportation behavior, but changing community engagement. I mean, it was amazing in San Antonio to see how many more people joined the like city council meetings because they could do it virtually from the comfort of their home. I mean, they had so much more public participation than I've seen. And it was amazing. And so bringing planners along with that and using technology to better reach these audiences who are out there and they care. But, you know, when you have one meeting at a certain location and who knows what transportation is like to get there, and there's armed guards at the building. And I mean, that's a deterrent for a lot of people if it doesn't address childcare needs. So part of these trainings and workshops that we think need to like have a platform sustaining these conversations needs moving forward needs to have that virtual component so people can do this from home. I mean, we can't go back. I know planning is tactile, but yeah, this is huge. Okay, I'm gonna skip the slide. Okay. This one is, yeah, this is on kind of the metrics point of view, but this is compiling academic research and best practices to update community impact assessment manuals goes towards the root of like the problem that I was saying before is we have these like standards from the 40s and the 50s. We have these from the state level coming down, these requirements that city transportation departments, that regional transportation departments have to abide by, no matter how, you know, enlightened their planners are and how their planners care about the intersection of health and equity. If we don't change the manuals at the top, it's not going to change coming down. So that's what this is, just one example of a recommendation going up at that level to change, to focus on the integration of transit and active transportation and Latino needs. So the twofold action plan, I wanted to, so a huge part is diversifying, is building up a career pipeline, is connecting health and planning in higher education. And then not just from the like public-private sector, but also from on the policymaking side as well, is getting more diverse groups involved in policymaking at all levels. And then creating, okay, I'm gonna skip this slide. My notes are super choppy on this one. And I know I am running very short on time. So if y'all definitely, of course, take, write down this link, and that's gonna take you to both of our reports in a PDF format. And I am happy to answer any questions.
Thank you, Amanda. Just wanted to remind everybody that we will send out the presentation link with the recording so they can access all of those links that you were referencing during your presentation. We are going to jump on over to our next speaker, and we will answer any questions at the end. So please welcome Renee Umstead-Meyer, who is going to share with us the Physical Activity Research Center Active Transportation. Renee?
Thank you very much, Susan and Amanda, for sharing such interesting work. I'm going to hopefully get through the Zoom toboggle of getting my slides up quickly. So let's see if we can do this. Susan, are we seeing the correct slide?
Yeah.
The whole thing?
Yep.
Okay, awesome. Thank you so very much for that confirmation. Perfect. Well, thank you all very much for joining all of us today. I'm excited to get to share about some of the work we've been doing and had the fortunate opportunity to be able to do. And our title of our IEE work group is Activating Rural America. And I'm going to do similar to how Amanda did, give a little bit of background on just the Physical Activity Research Center. Briefly, for those of you who aren't familiar with the center, we usually call ourselves PARC, P-A-R-C, and you will see that we have a website that you can always look at additional information. I referenced that throughout some of the presentation today. And before I go any further, I just want to say a big thank you and acknowledge that this project was not possible without and was funded by Voices for Healthy Kids, an initiative of the American Heart Association, funded in part by the Robert Wood Johnson Foundation. So the Physical Activity Research Center, or PARC, was formed in 2016. It's a collaboration of internationally recognized faculty from 6 leading universities. We have varying backgrounds in public health, city planning, behavioral science, and parks and recreation. We were funded by, funded by the Robert Wood Johnson Foundation as part of a larger effort to build an inclusive culture of health across America to ensure that all children have opportunities to grow up at a healthy weight. And we, as part of this work, are part of PARC, we had 4 core research studies that were conducted and 6 commissioned study projects that specifically spoke and where we partnered with Voices for Healthy Kids. The mission of PARC, we aim to build the evidence base for policy changes that will help make physical activity an everyday experience for all children. And this infographic is one that we've used in some other presentations that really tries to capture all that we're doing. We're building evidence, we're identifying and promoting solutions, all to advance health equity through active living. So our work specifically that I get to talk about today is part of Voices for Healthy Kids, the Innovation, Equity, and Exploration Special Project Work Groups, the IEEs. And within this, these are, most of us on the call know what these are because this is either your 3rd call, 2nd call, or you're familiar with this. But just to make sure that if this happens to be your first one of these calls or you're not as familiar with Voices work and specifically the IEE work group projects, this has been a great opportunity to get to explore some different areas that aren't necessarily as well known to hopefully provide some useful information back to Voices for their future work. For us and our work on with the Activating Rural America, we focused on the active living policy levers. So similar to what Amanda was saying, I'm not going to repeat it. There is a need for physical activity when we think about overall healthy kids and healthy communities. And so those 3 policy levers, as they were, they've been slightly revised this round, but as they were when we were thankfully allowed and awarded this project, we're focused within the Healthy Equitable Schools around safe routes to schools programs. And then also within the active and equitable communities areas for voices, looking at the complete streets and bike and pedestrian appropriation areas. So our purpose for this project is to inform voices for healthy kids of rural practices and challenges regarding these active living related policy levers with specific attention to health equity. And as part of this, we approached it thinking that one work group wasn't enough. So we thought of thinking really about, there are two different types of groups we wanted to make sure that we were in touch with, that we were advised by, that we were able to listen to and be able to bounce ideas back and forth with. So we formed an advisory group with national advocacy organizations, and I'll show a list of these in just a second, that help provide higher level perspective. They gave us reviews, giving us feedback on methods and materials, and will be assisting with dissemination. And we also pulled them in to some conversations with our work group. Our work group has been just amazing. They're rural community leaders or members engaged in active living related policy work. And those work group members have met with us 1 to 2 calls per month. Until this summer, we finally slowed down to like 1 call per month. And but that was really because we wanted to get to know one another, to accomplish our project goals, which I'll pull up in just a second, produce deliverables, and learn from one another and guest speakers. And let's see. So the goals of our overall project: to identify and describe these current rural efforts to adapt and advance the Voices for Healthy Kids active living policy levers where it makes sense. The specific attention to approaches or challenges related to health equity in these rural communities. And this has really worked in 2 different parts. We started out with scanning and synthesizing policy and advocacy literature and web presence, and identifying rural communities engaged in this work and kind of what was happening from that level. And then our second approach has been conducting and synthesizing key informant interviews with rural communities engaged in this work, with the hope that we'll be providing recommendations. That's our plan. We are still working on wrapping those up, and considerations to voices for next steps and continuing to possibly modify policy levers for rural communities, or at least know where the emphasis should be directed. And then this third larger bullet point: to develop meaningful deliverables that can be used by a variety of stakeholders with interest in rural health and physical activity. Our leadership team, which I want to acknowledge Dr. Christian Albilzo, who joined me. Thankfully, he's on the call today. And the rest of our group, Amanda Walker, is not on the call with us today, but she has also been an important partner in the leadership team, as well as having 3 very invigorated and passionate graduate assistants that have helped in varying ways with this work that are here. I'm very thankful for our Voices for Healthy Kids partners who have given us varying degrees of feedback and encouragement and suggestions along the way, and it's just strengthened our work. Our advisory group that I mentioned, so we have met 3 to 4 times with this group, as well as pulled several of them into speaking with our work group. They've given us invaluable feedback in our key informant interview guide development, into deliverable thoughts, as well as helping us connect with some of the communities that they knew about. And our work group membership, and this is the first slide of 2, we wanted to make sure we had representation of people on the ground doing this at varying levels in rural communities, or connections with multiple rural communities, making sure that we had all 3 of those policy levers represented in terms of the work being done, often noting that many of these people do several of these different things. So you can see that the front end, and then our second listing of our work group members. And really without these people, and we have at least 1, if not 2 of these work group members on our call today. So thank you for joining and supporting us. And one of the things I want you to know, we have a list of the different things that this work group has been doing since really getting up and running in November of 19. And it has been amazing to one, get to know these individuals and the work that they're doing, to be able to learn from them, but also to be able to just feel their passion for their communities and the people that they serve. I think the other thing that, while Christian and I both have always acknowledged that there's a need to pull together rural communities, just in terms of, it's hard to find one another often. It's like hard to find who's doing this work somewhere else in another small town. And this work group has really become a network and a place of support for the work group members. And they are still excited to be engaged. They've shared some of their own work with one another. And we started out really trying to make sure that we knew one another. They knew the purpose of this project. We spent a lot of time in those first few calls trying to get us into, this is what the literature looks like. So sharing those results with them, getting their feedback, into developing an interview guide, getting their feedback on that, and that iterative process, into starting to introduce some of the areas that they wanted to learn more about as we went. You can see the back end of our work group calls and some of the information we've been covering and talking about. So goal progress from where I started. So the literature and web synthesis, we were able to start on that pretty quickly as we started pulling together our amazing group of advisory group members as well as work group members, and really looking at gray literature, academic literature, and web synthesis from a rural standpoint. Some of the themes that emerged around safe routes to schools and complete streets and bike ped appropriations. You can see there on the left, as well as looking to see how many, when we did a Google News search, really saying, okay, well, what types of articles are we seeing in rural communities in these different areas? And then this is a lovely map that Michelle, one of our GAs, created to show where in the nation are we seeing these different literature sources and these different themes emerging for these 3 policy areas. That led us into the interview guide development and or these deep dives. And so as I mentioned, the guide was developed, it was reviewed by both the work group and the advisory group members. It was refined several times. It made it a much more solid guide. And in fact, the Voices for Healthy Kids partners also helped making sure that we were using as broad of language as we needed to get as specific of information as we wanted. And so that was refined, finalized. It had IRB non-human subjects designation, and then we started working on case study community identification. And that's really right around when COVID hit. And so we did have some delays in terms of, one, making sure that our work group members weren't any more stretched than they already were with all the multiple hats they were wearing for their rural communities. We had one, I guess, and the other thing would be identifying and being able to connect with our interviewees who also were juggling things. I think there was one interview that I was sitting on where the person we were speaking with in the middle had to get up and go grab the masks that were being made from somebody else in the community because she was going to be dispersing those later on in other parts of the community. So that angle of rural community members and leaders doing so many things within their multiple hats. But we had some amazing communities identified from those recommendations, connections, and literature review findings, wanting to make sure that we had good representation across our policy focus areas, those policy levers, as well as trying to get geographic diversity where possible. We recorded those using Zoom, and then we had those transcribed verbatim using rev.com. And we are currently in progress with finishing up coding and synthesis of those, and I'll be sharing some preliminary results with y'all today. So just as a look of where are the 13 interviews that we were able to complete, and I have a map on my next slide that shows where they're located more visually. So our coding process, after completing all of the interviews, was we, as a leadership team, took 3 transcripts for initial memoing and theme generation. So we did not have a coding tree at this point. It was a process of creating a coding tree for those of you who love qualitative data methods and analyses. And we did use our interview guide as a general guideline for creating some of the primary or parent codes, the broadest upper level side of those, and then looking for kind of what do we see underneath these broader themes when we look at the actual responses from these interviews. And those are based on recurring topics that we read. After that point, after doing some general memoing and starting to really create what became our coding tree, or the initial phase of our coding tree, which includes all of the themes that we were kind of seeing more than once, or that are meaningful around these different areas. 4 leadership team members encoded 3 transcripts with consensus discussions between each to make sure that we were solidifying the coding tree. And so that was iterative. And 2 of these transcripts came from our initial memoing. And then we randomly selected a 3rd transcript that we had not used in our initial memoing, making sure that we had 1 transcript from each of our different policy lever areas in this front end to make sure that we're finding everything and hopefully have a coding tree that's going to work across the 13 interviews. And we are at the point of dividing up the remaining transcripts to complete the coding process. So I mentioned that I'll share some preliminary results with y'all today. And I also hopefully stated a second ago, and it wasn't too confusing, that we had 1 complete streets focused interview that was coded in this part, 1 safe routes to school, and 1 bike pedestrian infrastructure focused interview that we included in this part, knowing that we are on to conquer the rest of them next. Before I get there, I'm going to show our coding tree, our parent code. So when we looked at kind of the broadest topic areas that were showing up that in relation to this idea of what's going on with these 3 different policy areas within rural communities. With 1, we wanted to make sure that we identified the primary policy lever or area that was being discussed in the interview. So it's been coded at that level. The policy status, so whether or not a policy has been passed, if there's something in progress, if there's not something official, just to be able to look at that more specifically. We wanted to be able to better understand across all of the interviews how or why efforts started. Some of the information, some of the feedback we've gotten from our work group members is that oftentimes rural communities don't even know where to begin. And so this idea of how or why did the people that are doing this work, how and why did they get started, so that we can share that back to other rural communities. Decision making, so who is involved in rural communities and how is decision making happening? And that's helpful because oftentimes sometimes can be very similar to larger municipalities, and sometimes it can be either more challenging or sometimes it can be easier in rural communities or smaller towns. So partnerships, who's involved in the relationships, not necessarily the decision makers, but who are those key individuals and or entities, organizations at whether it's the local, regional, state, national level that are involved in the rural work. Funding, successes, barriers, sustaining efforts, lessons learned, and then things that are unique to rural areas from the perspective of the interviewees. And this is very small, but I just wanted to give you a visual of, I just gave you the top circles on each of these. This is our full coding tree visually. And so you can see that we have, we're only 3 deep. For those of you who do qualitative work, we only have a few grandchildren codes, but we do have multiple child codes to try to really be able to look across all of the interviews on the back end to be able to say, this is where things are working. And this is what we're hearing consistently across, or here's a nuance that's occurring within a certain policy lever. So to give you an example of some of the results from this initial, and these are broken down just as a reminder, I'm showing on this slide some of the results from the 1 interview we coded, so 1 case that represented bicycle pedestrian infrastructure. And some of the things around this how or why efforts started in this community to improve safety, and local needs were identified. So they were whether it was a community assessment or whether it was hearing from the local residents that this was needed. The decision makers included in this community, county officials or staff, economic development, local advocates, local elected officials, and state level representation. Key partners were healthcare, a number of local partners, so business owners, elected officials, residents, schools, higher ed, volunteers, the state advocacy organization, the State Department of Transportation, and then there was a specific coalition that was involved as a partner within this example. How does decision making happen within this interview? Building on small projects, collaborating with higher education, using data, whether that's qualitative or quantitative data, educating others, and hosting events where around this is how we actually move decision making forward. Barriers included a lack of perceived value for this work within the community. the fact that they were working with a volunteer workforce, a lack of funding and a need for grant writing expertise. This idea that policy work takes time came up numerous times. Leadership turnovers and transitions, short-term delays, and this idea of the power of one or / people wearing multiple hats. This idea that one person is doing so much and can do so much can be both a barrier and a facilitator. So a few quotes from the specific interview that are highlighted in terms of this idea of what advice would you give others? What lessons have you learned? And I'll let you read through that quote. And the other two, are there anything else you wish you had known before you had started doing this? Yeah, maybe just how long it would take for those of you doing policy work, this revelation. And I think this last quote on the slide is also telling from a rural perspective. This idea, I had a friend who lives here, went visiting somewhere, and they had connection to sidewalks and bike trails, and they were like, oh my God, they have roads just for bikes. She was like, how important is it that my kid didn't know what a sidewalk was? Introducing it, I think that has been the biggest success, is people going, we do need this. I think people think of themselves here as humble and we don't need those fancy things. But once they use them, they're like, these are really nice, and it's really important for all generations. So just some highlights of some of the awareness pieces and some of the cultural norms that are showing up in these interviews within rural communities. So with our complete streets example, the same parent theme areas that I'm highlighting here. So how or why efforts started to reduce chronic disease. Again, local needs were identified. There was state-driven funding, school partnerships, some key partners in this community of healthcare, and a slew of local partners, elected officials, health department, residents, schools, higher ed. There was a national advocacy organization involved. There were regional level partners, a conservation agency, development agency, and at the state too, advocacy organization, again, the Department of Transportation and the health department. How does decision-making happen? Using data and using media or local stories in this community. Decision makers included economic development, local elected officials, municipal and city staff, older adult or senior organizations, schools, state level representation, and young or new residents. And some barriers that were noted within this specific interview were policy work takes time, again, short-term delays, and short-term delays included things like COVID and or weather, and or maybe there was a water main that broke, and so the resources got deterred from the efforts here over to that more immediate need. Again, leadership turnovers and transitions, lack of perceived value, funding restrictions, and again, this idea of the power of one or multiple hats being worn. Some quotes that came out of this around, the first one's around success, and then two other quotes that really highlight some of the uniquenesses of rural communities. And just pause for a second and let y'all read through those. I think as you read the third quote, this idea of, oftentimes I think the way we talk about small towns and rural communities is that there's lots of barriers because they're very different than what we know from an urban or suburban perspective. And oftentimes there are many strengths that also can exist within these smaller, more close-knit communities where everybody knows everybody. And this idea of, we want to get it done. I know the person to do it. Let's call that person up. Let's go do it. So this next, our Safe Routes to School example is looking at these preliminary themes that emerged on how or why efforts started. Again, there was state-driven funding or legislation within this example. There was existing infrastructure to support the efforts to reduce chronic disease, which is the second, it showed up again, pre-existing partnerships, existing culture to improve safety again, and again, that local needs were identified. Some key partners at the local level, businesses, Chamber of Commerce, elected officials, health department, residents, schools, police, and law enforcement. The regional level, another conservation agency. At the state level, again, the third time we've seen the Department of Transportation, the health department, and advocacy organizations. And one thing to note around, and there might be an example just a second in this quote, is one of the things that's very, that is unique in rural communities is who owns the roads and who has permission to give approval to changes or policy around roads. Really varies across states and is much more of an important thing to consider when it comes to any policy work around streets and roads. Some barriers: leadership and turnovers or transitions again, the volunteer workforce, funding, short-term delays, event participation. Decision makers included state level representation, county official or staff, local elected officials, municipal city staff, police or law enforcement, schools, and local advocates. And how did decision making happen in this community? Education of those around them in the community and leaders, events, building community support, using data, local advocacy organization, a phase plan, and this idea of a return on investment. So a few quotes that came out of this specific interview. So what was key? I don't know if sales pitch is the right term, but what was the key factor that really hooked to that director of the chamber? And this is around how did they get the Chamber of Commerce engaged as a partner? And I'll read through this again, this idea really highlighting that the Department of Transportation is important from a partnership and decision making. The other thing, these last two quotes in this example are, I think, really resonate across the interviews as well as with our work group. So the key is to make sure that you have a good group of local people that are with you at the beginning of this program throughout the initiative, because it's important in rural communities. And then I think this is true of all the smaller rural communities. Everybody does know everybody. And so having that built-in connection with the mayor and with the city councils, it makes it much easier. It could also present a barrier, but oftentimes we heard it really shining through as something that helps facilitate the policy process and the efforts that are occurring. So where we're at now is, as I mentioned, finishing up the coding of the remaining 13 interviews, or well, there's 13 total, so the 10 remaining. We have, based on our conversations with our work group members, as well as our advisory group members, we are working towards a one-page summary for each of the policy areas, with the audience being elected city officials. That really is a summary around those different policy areas. We're also developing case studies for each of the, so a one-page narrative case study for each of the different interviews that we conducted, with the audience being city staff or advocates, that it really shows this is how a community did it. This is something that happened in a small community just like yours, so it can be picked up and used in other communities. And this third one really came out of feedback from our work group, this idea of a playbook. So the audience would be implementers, people that are working in the policy effort realm. And this idea that lessons learned that can be used to activate other rural communities, steps to take, how to get started. And so we don't see that necessarily being super large. We definitely will be highlighting other resources that already exist. But this idea of how do we get started, what we hear over and over again is this idea of we're not like Chicago. There are lots of things out there for bigger cities. And sometimes it's even the bigger rural rural areas. And there's not a connection for rural communities often to say, I can do this, because it's not, they can't envision themselves being similar enough to the rural places to be able to say, I could do this here too. So trying to provide some of these case studies, some of these examples from rural communities, small towns that are doing this work. And I want to thank, again, Voices for this opportunity. And I know that I'm slightly over time, but hopefully not too bad, Susan. Hopefully not too bad. So I will stop sharing, and definitely we'll be able to follow up with questions outside of the webinar if we don't have time today.
Thank you, Renee. Our final presentation today is with Melissa Buffalo and Chris Johnson from the American Indian Cancer Foundation. I will kick it off to Melissa and Chris.
Can everyone hear me? Susan, can you hear me? Yes?
Yes.
Okay.
Mm-hmm.
Hopefully I don't talk too fast, as I realize we are at like about 20 minutes to present. So if I'm talking too fast, someone stop me. But my name is Melissa Buffalo. I'm the Deputy Director with the American Indian Cancer Foundation, enrolled member of the Meskwaki Nation in Iowa. I'll let Chris introduce himself real quick.
Hello, my name is Chris Johnson, and I'm the Prevention and Policy Manager at the American Indian Cancer Foundation, and I'm enrolled in Assistant Waptin Oyate.
Awesome. And we are sharing our slides, so you're going to hear us telling her to advance our slides to save time. So you can go ahead and go forward. So the purpose of today's PowerPoint again and presentation is just to give you an overview of the American Indian Cancer Foundation, which is ACAF for short. So you hear us say that throughout the presentation. I will kind of give that overview, mission and vision, and then discuss some of the inequities faced by our American Indian, Alaska Native communities, thinking about that policy systems environment change. And then Chris will kind of go into a little bit about the change as well as the thinking about the policy lever alignment and more of the actual project. Next slide. So our ACAF story, so really thinking about the American Indian Cancer Foundation is a national nonprofit. We are housed in Minnesota. We were established to address those tremendous cancer inequities faced by American Indian and Alaska Natives. Again, the mission is to eliminate those cancer burdens on our American Indian families through education, improved access to screening, early detection, treatment, and survivor support. And again, we are a national organization housed in Minnesota. We were founded in 2009, becoming operational in 2011. So a young organization. We're about to celebrate our 10th year. So it's hopefully 2021 allows for some in-person celebration. Just wanted to also highlight that all of our board members and the majority of our employees are American Indian with an array of experience and expertise in serving the health of our American Indian Alaska Native communities. Again, just thinking about our vision. So the vision of ACAF is really to see a world where cancer is no longer the leading cause of death for American Indian Alaska Native. It is, again, the leading cause of death. Oh, you can go to the next slide. Thank you. And thinking about that through hard work, culturally appropriate, community-based programs and policy change that afford Native people access, again, to the best prevention and treatment strategies. We really do see a day where myself, my children and my grandchildren will see a day where our communities are free from those burdens of cancer. Next slide. And so that really takes us to those, why we do this and what that data shows. And we think about those inequities faced by our tribal communities. And we know we need to start with data when we talk about those health issues in our Indigenous communities. So really thinking about how do we have that accurate data? And again, it goes back to some of these projects that we are able and fortunate to lead and to conduct with our communities. And we know that data is a struggle in Indian country, and that's due to several reasons. Most common being the smaller sample sizes. And then again, the big one is that racial misclassification. And I just wanted to highlight, according to the National Congress of American Indians and Alaska Natives are sometimes described as that asterisk nation. Because of that asterisk, instead of having a data point, sometimes we just get to be an asterisk saying there's not enough data that displays some of that data that can be out there that's for some of our other racial and ethnic backgrounds. So again, thinking about that overall, facing those alarming inequities in cancer incidence and mortalities. This image on the right really looks at that cancer death rate for American Indian Alaska Natives. So where the orange from 1990 to 2009, cancer death rate has gone up, where for the white trend, it's going down. So we look at those celebrations across the board, but unfortunately for American Indians, those cancer rates are going up when in other cases it's going down. Next slide. So at ACAF, we really understand that need to assess our ways of life as Indigenous people when starting any new initiative. So our worldview as Indigenous people has always been nonlinear when compared to the Western worldview. So we think about that Indigenous worldview, which is more about that interrelatedness, balance and sustainability. So we think about those life ways that are really rooted in culture and grounded in respect for all living things. So just giving you guys time to look at this visual that we have. And we know that Indigenous people are often collective in nature versus individualistic. We think about those collective cultures that really emphasize family and work group goals that are above those individual needs, whereas individualism really emphasizes personal achievement. So we're really working to strengthen this connection that really creates opportunities for us to be healthier as Indigenous people and for the communities we serve. So we really use this worldview to really guide our work. Next slide. So in order for us to really be at our full health potential, we really need to acknowledge and understand those adverse social determinants of health that have really hindered our ability to achieve health equity as Indigenous people. So we think about those social determinants of health, which again, really include that historical and intergenerational trauma. Not things that happen in the past, but what are some of those that are happening that have been passed down through colonialism, genocide, stress, disruption in childhood development, that poor access to healthy food, service, employment, education, and transportation. So really many of these adverse social determinants health really have a cycle of those adverse childhood experiences, again, such as household dysfunction, abuse, and neglect. And these oftentimes lead to some of those behavioral risk factors, such as lack of physical activity, unhealthy eating, commercial tobacco use, and addiction. And we know that these behavioral risk factors then lead to poorer health outcomes and ultimately early death. Next slide. So when we think about engaging in that upstream approach to really achieve the health equity, really means we need to support positive social determinants of health, such as social and economic opportunities, and increase access to healthy foods, sacred medicine. And I think they talked about in the last two presentations, really thinking about that healthy, having safe physical activity spaces and the importance that that plays. Access to healthcare, education, housing, modes of transportation, and access to the internet, such as what we've been able to do these last few months really has shown as we've gone into COVID. Another key piece to achieving full health potential is by breaking cycles of trauma. I was really going to go down this deep dive, but I'll save us time when we think about the trauma and the impacts that really play today, and that, you know, as Native people, it's not always the boarding school, but what are those effects as Chris and I are grandchildren of some of those boarding school experiences, you know, as our grandparents had those, and what that impact is on us and others. Next slide. So again, thinking about those persistent inequities, we know that American Indians face tremendous health inequities in cancer and other chronic diseases, again, largely related to health behaviors. And we know one probably plays into the other. And we know that American Indians also are often on the worst end of every health indicator. So as I talked about being an asterisk nation, there's also that other end where, you know, we have some of the top disease rates and deaths, and it's such an unfortunate, and being able to spin that so that there's some strength and resiliency when we're seeing some of this data. And again, that goes back to, we're all here because we are resilient people who have been working together to create positive and impactful changes, again, to promote those healthy norms in our communities. And we do that through those relationships and the importance of that. And Chris will kind of get into that here in a little bit. Next slide. So we know that those health outcomes for Indigenous people is entirely determined by history. And I talked about how much I really wanted to go into that, but I'm talking really fast. So health inequities are directly linked to determined and deliberate efforts of the United States federal, state, and local governments to uproot American Indians from their lands, eradicate their languages, and destroy their ways of life. And I think, again, hearing some of the previous two presentations, and some of that could totally play into this, and those relations between our presentations. So when we think about those, we really want to acknowledge those systems historically and continue to impact the health of our Indigenous people. And we really know that's some of the first step that we have to do. So we have to work together, and I think this project really allowed for that. And we know that the work ahead is really reclaiming a strong and healthy future for our generations to come. Next slide. So when I talk about some of those government policies and those systems and environmental environments that impacted American Indian Alaska Natives, we think about these various acts, and I won't go into them, but I do want to highlight this picture is Chairman George Gillette, who was signing away land for the Garrison Dam to be built, I want to say in the 1940s and 50s. And so for me as a Native person, being able to see this picture and seeing, you know, the emotion, and then you look at the other people and how much to me, it's just like, oh, they're just, you know, sign this paper so we can go to lunch. We have other things to do. So I think about that impact and about this one person who did his best to save over, I think it was 300,000 acres of land that were taken. In lieu of time, I am actually going to have you go to the next slide. So again, we must keep those unhealthy behaviors in the context of trauma. What are some of both historical and current? What are some of those stresses such as racism, poverty, other systematic inequities, historical genocide and colonization, and again, living with the oppressor. So unlike other marginalized communities, American Indian and Alaska Natives still remain on this land base and are really regulated, influenced on so many ways by the federal government for the past 500 years. Next slide, please. So we know that health equity is crucial for the well-being and vibrance of our communities. And I talked a little bit about that, and I'm gonna let Chris also talk about that through our work with this project. So we know that health is a product of social determinants and health disparities, and that those health inequities stem from the structural racism, discrimination, and poverty. And then we need those solutions really to be tribally led, community-based, and rooted in culture. And Chris is gonna talk a little bit more about that.
Thank you, Melissa. You can go to the next slide. So at ACAF, we really, like to go and take that upstream approach to advance health equity. And we do that through PSE change, policy system, environmental change. And so our upstream approach is really about offering culturally tailored technical assistance, trainings, education, and other resources, which you'll be able to see in a couple of slides. Do you want to go to the next slide, please? And so when we talk about PSE change, we really like to take it and view it through an Indigenous lens. And so we'll kind of go through that today. So as we know, PSE change is making changes at the policy systems and our environmental level to affect a broader impact, advancing health equity and achieving that health equity. So you can go to the next slide. And so as Indigenous people, we walk two paths. So that European model that the US was built on, but also that traditional side with the different traditional practices and lifestyles that we were raised on as Native people. And so we needed a framework for creating positive change at the community level. And so we can do this by simply relating these Westernized concepts to our Indigenous worldviews. So that worldview that Melissa talked about earlier. And so, oh, can you go to the next slide, please? Sorry. So here we can look at like the policy change and what that means for, in our public health months and having that definition there. But we can also think about policy change through an Indigenous lens. And so that's really like those guiding principles for ways of living. So things like respect for elders, never taking more than you need, or showing appreciation and respect for all living things. And so we can really think about those ways that we all live as policies within our communities. You can go to the next slide. And so the systems change. The public health definition here is, changes of how things are done at an organization or setting. And so when we think about this through an Indigenous lens, we think of them as like the building blocks of a community that allow it to function as a whole. And so throughout our history as Indigenous people, our systems really promoted health and wellness. And so things like family, clan, or band systems, those food and medicine systems that we lived with, and then the different tribal government systems as well. And the next slide, please. And so the physical environment of our ancestors can be thought of when we think about health and wellness in that environment. And so things like hunting and gathering or living off of the land, we think of this in a more contemporary thing, mindset of like lack of permanent built structures, lack of pollutants poisoning our Mother Earth, and constantly being in motion, really make sure our people were healthy because we were always moving. Can you go to, oh, sorry, you're on the right slide. So we do want to acknowledge that we as Native people are a sovereign people. And so we can use that as an asset when leveraging positive change and health equity in our tribal communities. And so here's the full definition, and I'll kind of let you guys read that on your own. But essentially, tribal sovereignty gives our tribal communities the unique ability to govern and, really create our own policies and systems within our communities. And so oftentimes we have these different policy changes, and some things like the state like smoking laws might not apply to tribes. And so they'll have to make their own policies around that. And then that really, allows for these culturally nuances to be really, implemented in the best way. Next slide, please. And so what can we do? And so we do it through authentically partnering with our tribal communities. And so really thinking about trusting the community that, that they have the wisdom and the solutions to address the health disparities that afflict their community. And so actualizing positive change strategies that are conceived through community member engagement and conversation. So thinking about working together to do these different changes within their communities. Like I said, doing that PSE change, applying a health and all policies approach, and things like that. Next slide, please. And so Melissa and I currently lead the Indian Country Policy Lever Alignment IEE group. And so this work was funded in part by the Voices for Healthy Kids, an initiative of the American Heart Association with support from the Robert Wood Johnson Foundation. And next slide, please. And so the purpose, mission, and goals of our group can be seen here. And so our group is really to understand the impact and the alignment of policy levers and initiatives with and propose different strategies that serve young children across Indian country. And so we're really looking to understand how tribal nations and American Indian Alaska Native serving organizations progress towards achieving these the policy levers, and so including like the implications for health equity, and in order to strengthen the current levers and overall just advance the success of voices. And so we're looking at exploring initiatives that are currently being implemented in Indian country to help identify, are they parallel? Are they, doing different things completely, and really finding those key lessons to inform the future policy levers. And so we'll also working on recommending 3 to 5 opportunities that improve voices, policy levers, and their engagement across Indian country. And so we're also, like others, working to increase collaboration and coordination among tribal, national, state, and local stakeholders working within Indian country. And so can you go to the next slide, please? And so we're working on this assessment with several of our tribal partners. And so our assessment is really to understand the impact and alignment, like I said, and so really to find those needs and those policy needs for our population. And so we were fortunate enough to be able to figure out how COVID-19 is really impacting their food work or access to food, all of that kind of things. So we do have some COVID-19 questions in there, just general community questions. And then we also just talk about the policy work. And so I put some questions in here that we ask our partners. So what are policy successes that your tribal nation or your community or organization has already implemented? And then just asking if they're engaged in any of the current policy levers for Voices for Healthy Kids, and then really finding if they're interested in those, if they're not already doing some of them. So really finding out where those alignments are. And so can you go to the next slide? And so what's next? We're currently working on coding and analyzing all of the data that we collected. We're working on coding that, and then we'll have a report out for Voices with those different recommendations. And so next slide, please. We thought we would show you all some of the resources that we currently have around prevention and policy work. And so this year is our Indigenous Lifeways, our prevention. And so it really talks about ways of living and how that can be seen as prevention. Next slide, please. Here is an informational resource letting women know that cancer is a leading cause of death for our population and that breastfeeding is cancer prevention. And so we've also added just different information on breastfeeding recommendations, ways to support mom with breastfeeding, and other organizations that can provide support. Next slide here. So this is our Sacred Traditional Tobacco for Healthy Native Communities infographic. And so we like to call these maps. And so we just have different areas within the community, and it identifies different PSE strategies for those sectors. And so we also have this version or several versions of this infographic for different communities. So we worked with a couple of tribes down in the Southwest to really tailor this infographic to look like their community, because we know in the Southwest, it's not always green like this. And so you can go to the next slide. And so we just wanted to show you one of the close-ups of the different sectors. And so this one is the Tribal Council and Government Center. And so PSE changes that you can do in the area, tribal tobacco policies that will improve community health, and then just prioritizing and supporting those community health initiatives. Next slide. And so we also have another version of the previous one, but for healthy eating. And so it's our Healthy Eating for Strong Native Communities infographic. And again, it just has those different PSE strategies throughout the community. You can go to the next slide. Here is a close-up for the clinic. And so some PSE changes for that area is offer culturally appropriate nutritional counseling, and including breastfeeding education, as well as initiating a fruit and vegetable prescription programs. And so with that, you can go to the next slide. If you guys have any questions for us, Melissa and I would be happy to answer those. And then the next slide is just our contact information.
Thank you, Chris and Melissa. We do have a few questions that have come in for all of our speakers, so I am going to hand this over to Nada to run through those questions for us.
Thanks so much, Susan. Since Chris and Melissa just did their presentation, there was a question for them, so I thought I'd just let you address that one first. The presentation indicates that tribal policy and change is best led, within the Native American community, as you indicated. Are there current advocacy activities occurring now to increase availability of foods and clean water in Native American communities since COVID has kind of highlighted these critical needs? And either one of you can take it, and
I don't know if I have the answer, so I'll let Chris go and then I can maybe add, not to put him on the spot.
So can you kind of repeat the question? I know it's kind of
long. Yeah, I mean, your presentation, both you and Melissa talked about how important it is that in your communities, that those policy changes happen within your communities and they're tribal led. And we know that COVID also made a lot of pivots this year to everything that's happened everywhere. But are there current advocacy activities within your tribal councils or something that are happening right now to increase availability of foods and clean water to your communities, with the need being so great?
Yeah, so I think so. We know that a lot of our tribal partners have, shifted a lot of their focus due to COVID-19. And so we're finding that a lot of our partners were just so swamped with COVID. And so these efforts were kind of put on the back burner, but I think now that, we're all getting used to, working remote, that they're starting to pick those things back up again. And so I'm really excited to see some of that policy work, because I know we had some really good policy work pre-COVID going on, and that just kind of got, put on the shelf. And so just ready for that to come back. So
sure.
Yeah, and I can add, thinking about that, So thanks for repeating the question. As we think about like knowing what the tribes are, again, there's 574 tribal nations within the United States. And I think within their state and within their community, we think about some of that CARES Act funding. And I know right now with Minnesota, there was an opportunity for tribes and some of the tribal orgs to get funds for food. And so thinking about what some of those foods as we get close to winter, and then, you know, preparing if those numbers for COVID are going to go back up with some of our, and then, you know, northern Minnesota is very rural.
Right. Yep. Thank you. Another question for you both that's come in is, do you think you'll develop a physical activity resources map like you did for the healthy food map?
Yes.
Or do you already have one?
I'll put a link in the chat. We do have one already developed. Happy to share.
Okay, that's great. Yui, if you could also add that with the links when we share this out, that'd be great. Okay. Do participants have any other questions for Melissa and Chris? I'm not seeing anything else, and I didn't want to miss anything. Okay, well, thank you both so much. I think I'll move on. Renee, you did such an excellent job, as well as all the other speakers. I don't have a question for you unless, again, there's one that's come in and I missed it. And I know that part of your work, you're still gathering some of your, final recommendations or thoughts. So it may be that some will come later, and if so, we'll be sure to share them with you.
Thank you. Please do.
Yep. And for Amanda with Salute, and I know, you were the first speaker, so it's maybe a little bit, so just to kind of refresh your memory, from your presentation and with the findings that you did that came out of your work group, what recommendations do you have for people working on the ground in active transportation campaigns right now? And how can these campaigns make an impact to address the findings today?
Oh, awesome question. So not to go like too massive in scope, but from the recommendations in the report, a huge component is to collect quantitative and qualitative data on Latino needs. Get out there and find out what barriers they identify, not just lack of sidewalks or lack of bicycle lanes, but find out what routes they're using, what routes they feel safe on, what some of these other silent barriers might be. And also doing a larger, so that's part of the inclusive of Latino needs, means you have to identify Latino needs. And kind of in that, also looking at how Latino communities are already making these adaptations to the spaces they live, to the public and to the private spaces they live, just whether it's through like fencing and murals or through street vendors, just recognizing how they're adapting their space around them and ensuring that gets built into existing policies, relaxing certain ordinances to allow street vendors or to allow whatever modifications they're making to the sidewalk or the street space. So instead of trying to come in with something new and different, is find out where are they already using this public space and how are they already adapting it? And then so that's inclusive of Latino needs, and then representative of existing inequities is doing an analysis of the current transportation network and access to opportunity, is looking at where there's overlap in affordable transportation and affordable housing, ensuring that connection remains strong in any active transportation investments moving forward. And I mean, also looking at many other destinations, not just employment centers, but employment centers where there's low wage employees or employees with non-traditional hours. So finding where those are, ensuring they have transportation connections. And then other destinations like childcare and employment and education opportunities. And then ensuring that whatever projects y'all are advocating for on the ground, that they're responsibly evaluated and measured. So ensuring that to whatever capacity you're meeting other requirements to fit into that, whether it's like the tip or with an MPO or however funding's coming from, making sure that how you are reporting out success is representative of the area of Latino needs, of existing inequities, and relevant to other health, social, environmental, and economic goals beyond just typical transportation metrics.
Okay.
And that's kind of a lot. I mean, that's a lot. Like, okay, yeah, we're going to do all that for some projects. But I think if I remember the question clearly too, part of it is as an advocate, is continuously making the connection between all of the other factors of transportation, because it is often so siloed and people do tend to focus only on congestion, is reminding everyone involved that, and find out what they are, find out what your community's goals are. If you have your community health improvement plan based on your community health needs assessment, identify goals that other stakeholders in the community have already set up and said, these are goals for our community. They could be related. If your city has like a climate action plan, like connect those pieces into the work you're doing to remind people we have way more goals than just congestion. And we need this to be equitably implemented to reach those historically disadvantaged populations. Does that help? Was that too much?
That was a lot, but I think you provided some great information. So one has also come in now for Renee from Phil. And he mentions that, he says, I noticed that you mentioned law enforcement and your key partners for safe routes. I wondered if you could speak to safe routes policy, removing enforcement from the ease and some possible alternatives. So that's for Renee.
Thank you, Phil. That's a great question. I would say that it'll be interesting to see, and I kind of put a quick response in the chat box just in case I didn't get to speak. That just time is such a strange thing in 2020, isn't it? So I would say it'll be interesting to see how we see it show up right now. What we're in the specific example that we included this in our presentation today, and also in my memory of the interviews that I was part of, it's not necessarily as specific as your question, but more around the idea of making sure that there are positive relationships and that there are relationships with police if police are part of law enforcement and one of the in the communities that we spoke with. And so I look forward to seeing if we see any of that actually as we move forward. In the specific transcript that I included today that we've already coded from Complete Streets, I actually pulled it up to make sure I wasn't missing anything after I saw your question in the chat. And it doesn't speak necessarily to law enforcement being involved within the specific efforts, but rather that it's important that there is a working relationship and a positive relationship there. I will pause for a second. Christian was on the call earlier, and he and I were usually on different interviews. So he might have something else to chime in on if he's willing. He responded in a chat. He said, as he recalls, it's part of securing approvals and escorting for children for riding parts so far. So we will definitely keep our eyes open if we see anything else from a rural perspective that shows up. And we didn't ask specifically that detailed level of a question within the interviews, but we did get lots of thorough responses. So if we'll be sure to make sure we note that. Thanks, Christian, for responding in the chat box also.
Thanks to Christian and to Renee for that. And there's another question that's come in for Amanda from Salud. And this I don't think is related to the first question. I think it was a separate question that came across the chat earlier. How do the recommendations you make differ from the equity components Smart Growth America added to their Complete Streets Guide updated in 2018? That's the first question. So how do the recommendations that you made differ from those equity components of Smart Growth America's guide? And then what exactly did you find in regard to Latino needs versus equity needs in general? And I think that question you somewhat have already, answered with your presentation, but you might have something to add. Amanda?
Yeah, with regards to complete streets, there's definitely a lot of similarities. It was awesome in 2018 when they did modify their like scoring criteria for how they grade the best complete streets, which is used as a guide too. So they included equity and various components of developing the policy, ensuring that they're addressing the needs of vulnerable users, addressing land use issues like I discussed in the presentation, and various other, so that there's definitely a lot of similarities and a lot of overlap. What is the distinction, I would say, is because like I said before, like this stuff isn't new, like it's there, it's, complete streets, they've been saying this stuff for a couple of years now. The one distinction is just simply that applies to complete streets policies only for cities that have them or maybe modifying them. Whereas our recommendations are kind of across the transportation board, for all aspects of transportation planning, for cities who don't have complete streets policies or for cities who have them, but they don't implement them. So definitely a lot of similarities. It's the same stuff. It's the same, evidence-based really to say we need density and multimodal, it's not new. So I hope that answers the first question. And then the second question specific to Latino needs. A lot of that is unknown. That's what really came up, is from the planners, from them, their observations anecdotally, what they're seeing in their communities, what some of the needs are. But these recommendations they're more than like advocacy and policy recommendations, but it's a research recommendation. We need more and better research on Latino needs. I know Charles Brown out of Rutgers a couple of years ago looked into specific needs of brown people biking. And that's huge. That's so valuable to the literature now to support recommendations, to support policy changes and stuff. And we need a lot more. We need it for walking. We need it for connections to transportation. And then, like I think I mentioned to the last question too, is these other adaptations that they're making already, is finding out what those are and making it easier for them to do that. And then finding other ways to support that. There's a lot of need out there. We got to do better at even. So complete streets, when they included equity into their kind of scoring criteria, one specific component is addressing crashes for pedestrians and bicyclists. One thing they don't specifically call out is disaggregate that by race, ethnicity, by income. So that's something else in the recommendations is, okay, so there's equity issues. We know people in some areas are at higher risk for pedestrian deaths. And thanks to a lot of other work done by Smart Growth America too, we do know some of this, but at a national level, we don't know this at the community level when you're on the ground trying to advocate for safer policies. You've got to be able to show the disparities, how it's burdening some neighborhoods, some populations more than others. And we don't have those numbers, so.
Okay. It looks like another question came in the chat for you, Amanda. It says, how much did legal status and exposure impede the Latino populations from connecting with local leaders in San Antonio? And I'm not sure if you can see the chat. It might be easier also for you to read it together. I recognize we not only have language barriers among the data and resources and outreach, but this is something that hinders many of us from reaching out to our leadership. If this was something that impacted connecting them, how was that overcome? It's a pretty long question, so I hope you can see that as well.
No, yeah. Oh, I can see it. Yeah. And it's such an important question. I definitely don't have the answer. And I definitely don't have the answer specific to San Antonio, but legal status, it impedes Latinos' involvement and participation in society in a lot of ways. And this isn't new either. I mean, think of access to like healthy food over the summer. So when transit agencies have like uniformed armed guards, that's 100%, that's an issue, that's a deterrent. When public meetings are held in buildings that have armed guards, that is a deterrent, that's a barrier. So I think some of these virtual meetings can help address that. And then doing more to, I didn't get it. So over policing is a question that our group brought up that needs to be addressed. In no way do we have all the solutions or answers to that, but that's a huge part of it too, is addressing discriminatory policing, and then not requiring, ensuring that at any public meeting or at any, if the transit agency offers discounted fares, that if you go to sign up for them, that they're not going to ask for documentation. If you show up to a public meeting, they're not going to ask for documentation. So ensuring that any outreach includes some level of assurance to these populations that it's safe, there's not gonna be any documenting. That's one level that doesn't address all the barriers at all, but that's one level. And then so language barriers, yeah, absolutely. I mean, when it comes to not just public engagement meetings, when it comes to wayfinding for trails, bike lanes, transit, everything. Yeah, that 100%, depending on your community, you need to consider language barriers.
Okay. Well, thank you so much, Amanda. Susan, I think I'll turn it back over to you. I don't see any more questions.
Thank you so much, Nada. So as we close today, we want to thank everyone for joining, and especially thank our speakers, Amanda, Renee, Melissa, and Chris. We appreciate all the hard work that went into your presentations. And I'd like to let the audience know to be on the lookout for a brief survey about today's webinar. We would really appreciate your feedback. It's a quick survey, should only take a few minutes, and your responses will help us shape all future webinars in this series. So thanks again for joining us. And again, we will send out the link with the recording and copies of the presentations. Thanks so much. Have a great day.
Thank you.
Thank you.